To address the role of the prosecutor is Monroe County Prosecutor Chris Gaal. Chris Gaal is actively engaged as a community leader to develop new resources that enhance public safety and created valuable public education and prevention efforts. Some of these initiatives include the Sexual Assault Response Team and Sexual Assault Nurse Examiner Program, Susie's Place Child Advocacy Center, the Monroe County Pharmaceutical Disposal Program, the Never Leave a Child Unattended Program, the Be There Dropout Prevention Campaign, and a Parent's Guide to Children and Technology. Gaal received the 2010 Outstanding Legal Professional Award from the Indiana Coalition Against Sexual Assault, the 2009 Visionary Leader Award from the Greater Bloomington Chamber of Commerce, and the 2008 Outstanding Service Award from the Campus Community Commission on Alcohol. Chris Gaal is a member of the Indiana Prosecuting Attorneys Council Board of Directors and the IPAC Elder Delinquency, Domestic Violence, and Sex Crimes Committee. He served as the chair of the IPAC Board of Directors from 2012 to 2013. Gaal also serves on the Foundation of Monroe County Community School Board of Directors and the Greater Bloomington Chamber of Commerce Franklin Initiative Advisory Board. Please welcome Monroe County Prosecuting Attorney Chris Gaal.
Being a participant here along with so many great people on this panel and so many great people in the audience that care a lot about this issue and are doing important work. I was asked to speak about the role of the prosecutor in responding to child abuse, and when child abuse gets reported to law enforcement or to the Department of Child Services, as was mentioned, they conduct an investigation, they interview witnesses, gather evidence, prepare a report that then documents that investigation. And if they believe that a crime has been committed, they forward that report to the prosecutor's office for us to review. And the traditional role of the prosecutor is then to review those reports, and if there's sufficient evidence to prove that a crime has been committed, we then file appropriate criminal charges and prosecute that case in court. Now, you'll notice that the main focus of this approach is on the offender, not the victim. I mean, the goal is generally to punish the offender, to deter them, and also to generally deter others from committing similar crimes in the future. That's the traditional role of the prosecutor in our criminal justice system. Now, in my view, the greatest weakness of this system is that we're stuck always reacting to a bad situation after it's already happened, after the damage has been done, after someone's already been victimized. And that can be frustrating for us. And I think there's a growing recognition in many jurisdictions around the country that we need to do more to supplement that traditional approach to criminal justice with other approaches that focus more on prevention and education. And that means the prosecutor has to do more than just the traditional role. The prosecutor also has to be a community leader on public safety issues, coordinating with other stakeholders in the community to create new resources where necessary to improve our response to public safety problems, and also developing public education and crime prevention initiatives that can prevent those problems from happening in the first place. My goal as prosecutor has been to try to do more than just the traditional approach, to try and get out in front of the problem. And one of my favorite sayings that I always say all the time is, an ounce of prevention is worth a pound of cure, because it's far better to prevent problems from happening in the first place than it is to always be stuck reacting after the fact. When it comes to child abuse, there are few crimes that cause greater public outrage, and rightly so. Physical, sexual, psychological abuse of children leaves wounds that will never heal, no matter how successfully and aggressively we prosecute the abusers. We can't fix that in the criminal justice system. We know that this kind of abuse is generational, that victims who are exposed to violence as children often grow up to be offenders as adults, or have been so seriously damaged that they may require lifelong services, and those services may be difficult to access in some cases. And at some point, we need to break that cycle. We need to begin to heal that damage. And that's why it's absolutely essential that we as a society, or at the very least as a local community, actively pursue measures to prevent those crimes from occurring in the first place. And when they do occur, to make sure that the resources that we have in place are there to address the needs of victims so that victims can become survivors. That's been the mission of the Monroe County Prosecutor's Office. Soon after I took office, I was confronted with a number of cases that involved parents who left their children unattended in vehicles or in a pool or at home. And sometimes it was just a bad decision, but nothing bad happened, fortunately. And other times, a terrible tragedy occurred. And those were difficult and disturbing cases. And it became clear that we needed to do something more than just react after the fact in those types of cases. We needed to think about prevention. So we got together with other partners in our community, and in 2008 we did the Never Leave a Child Unattended campaign, public education campaign. And we got the word out pretty effectively all over the community. We had a poster, and based on that experience, I really came to appreciate the opportunity that we have to make a difference and address problems in the community through prevention work. In 2010, I met Emily Perry to talk about the need to create a child advocacy center to serve Bloomington in this area. And in the spring of 2011, only a year later, we opened the doors of Susie's Place. And I never would have believed that we could move so quickly from the idea to the reality, but we did, because it was the right idea and it was the right time to make it happen, and we were able to bring everybody together and work together as a community to make it happen. As prosecutor, I want to make sure that when there is an allegation of child abuse, that the investigation that happens in response is done right, so that the information that my office gets is the most credible and reliable information possible, so that my office can make the right decision about filing charges. And then if we do file charges, that we have the most reliable and credible evidence to prosecute that case successfully. Susie's Place has dramatically improved the quality of our child abuse investigations in this community. It's allowed us to respond to reports of child abuse far beyond what we were capable of doing previously as a community. And before, a child may have been interviewed several times by different people. Sometimes the detective assigned to the case or the person interviewing the child, may have had some experience or some training in how you conduct interviews with child victims. Frankly, sometimes they would not. And it was luck of the draw who you got. But you only get one chance to do this right without asking leading questions that suggest answers. And interviewing a child victim or a child witness requires a very special set of skills. And now we know that in our community, the person who's conducting that interview will be a professional with the training and the experience to do it right the first time, one time, using the appropriate protocol for conducting an interview of a child, and will be supported by a multidisciplinary team of people working together to do the best job possible. And now in our community, a child who discloses abuse to DCS or to the police is often referred to Susie's Place for an interview, and it's made a real difference. But there's still more work to do, because with every success, it brings a new challenge. And right now, in a child sex abuse investigation, depending on the circumstances, a child may be referred for a follow-up pediatric medical examination by a sexual assault nurse examiner or a P-SANE examination. And the only place that currently conducts pediatric SANE exams is Riley Hospital in Indianapolis. And a significant percentage of these cases involve families who are living in situations of poverty, who simply don't have the means to get up to Indianapolis for that exam. We don't want a situation to occur where a child was referred for a follow-up medical exam and they didn't get that exam. Because then not only did that child not receive the appropriate medical standard of care, but the investigation might be challenged as incomplete. Every child that needs a P-SANE exam, that is referred for a P-SANE exam, should be able to get a P-SANE exam for the benefit of that child and for having a complete investigation of the case. Our local medical community have been very positive working with us to try and address this need. We've been working on protocols, creating the necessary infrastructure to begin offering a local P-SANE program right here in our own community through IU Health Bloomington Hospital and Riley Physicians. And we are now close to making that happen. And that will be another huge step forward, a missing piece of the puzzle to improve our response to child abuse in this community. I also sit on the Child Fatality Review Team, and our mission is to review child deaths and evaluate if a death was preventable, make recommendations about what could be done to prevent similar injuries or deaths in the future. And for a while, I've been aware that one of the most effective programs that's out there is the Nurse Family Partnership Program. It has a broad range of benefits, social, economic, health benefits. It's documented by over 30 years of research and trial outcomes, and it's widely recognized as an effective, evidence-based program. But I want to talk specifically about the public safety benefits. Here's some of what the research shows about how the visiting nurse programs impacted public safety. A 48% reduction in child abuse and neglect, 39% fewer injuries among children, a 56% reduction in emergency room visits for accidents and poisonings, a 59% reduction in child arrests at age 15, 61% fewer arrests of the mother, and 72% fewer convictions of the mother. Even though this is an intervention in the earliest stages of life, for first-time mothers living in poverty during the first 2 years of their child's life, the positive benefits of the nurse-family partnership last well into the later years of childhood development and can have lasting impacts over a lifetime. So this is one of the most effective things that we can do to enhance public safety in this community. And it's also one of the most cost-effective when you look at the costs and benefits over the long term. But we have to think strategically with some long-range vision because these outcomes don't happen overnight. The research supports that these benefits are real, that they enhance public safety, they help create a safer community. And so the prosecutor's office is working with IU Health Bloomington Hospital to create a nurse-family partnership program to serve our community. Dana Waters is here. She's instrumental in that effort, and we'll be working on grant requests to get funding. Those funding opportunities are out there. We want to make this happen in our community and think it has a huge potential to make a difference. There are other kinds of public education prevention efforts that our office has been involved with. I don't have time to talk about all of them, but I wanted to give you some examples so you get the idea. We focused on dropout prevention. That requires a community-wide effort to be successful in addressing that issue, and we're fortunate that in our community, our focused efforts, we've been able to build kind of a broad-based consensus of people working on this problem, and look what happened. In 2007, the Monroe County high school graduation rate was 80% on average. In 2014, we're at 93.5%. So we have moved the needle on that issue. The prosecutor's office was involved with that, along with a lot of other community partners working together, and we're continuing those efforts. We helped create the NETS, Nurture, Engage, Transform, local chapter of Prevent Child Abuse Indiana, which is a co-sponsor of this event here today. We developed the Children and Technology Parents Resource Guide to help parents understand online privacy and avoid problems like sexting and cyberbullying. We're currently in the process of reinventing our child support program, and this is something I'm really excited about. Again, supplementing the traditional approach to child support collections with new ideas because the traditional approach is limited. And it's not been effective in collecting support in situations where the non-custodial parent, the parent that owes that child support, can't pay because they don't have the education, training, or skills to get a job, or they're unemployable due to an addictions problem or a mental health issue. And so we're exploring how we can partner with other service providers in the community in areas like workforce development, addictions treatment, and mental health to try and address some of those underlying problems so that we can offer more carrots alongside the traditional sticks. And we anticipate that ultimately that will lead to an increase in child support collections as it's done in other jurisdictions around the country that have tried that type of an approach. So we're doing some very interesting and progressive things there that are outside the box. I just want to sum up now by saying that the prosecutor's office, the role of the prosecutor is not just to be the courtroom advocate, but the prosecutor also has to be engaged in the community, working on these types of public safety issues to create new resources where we need them, public education prevention efforts to better address public safety problems, and we're doing that in Monroe County. And so I appreciate your interest. in this issue, and I look forward to working with you to find new ways that we can respond to and prevent child abuse in our community. Thanks.